Hello friends, and welcome back to the channel. And in today's video we are going to be discussing the common questions which I get about working in Dubai. What is the salary? What is the accommodation and which branches are in common? Requirement or which job or which specialty is in high demand here? So I'll just try and address those couple of questions here. So the first thing is which are the branches in demand. So I can maybe divide this into clinical branches and non-clinical branches. So almost all of the clinical branches are in good demand here. Like if you have a surgical specialty or if you have radiology, any other branches in clinical practice which are routinely where we see patients and we treat them, they are in very good demand here. As far as the non-clinical specialties go, say for example biochemistry or preventive and social medicine and so forth, there are many colleges here as well. Based on your qualification and your degrees, you can go through the door eligibility criteria paper and the D-Sharian portal where you can do a self-assessment test and you can then come to know what is the minimum criteria of qualification and experience you need in order to work as a non-clinical or as a clinical specialist. So based on that, you can decide. But definitely there are many specialties are in demand here. And the scope of clinical practice is very good. Second is the salaries and the accommodation which is asked. So usually there are three categories of people who work here. One is the registrar level, one is the specialist and one is the consultant level. So registrar is somebody who has finished his MBBS and internship and is then working as a junior doctor or as a specialist registrar. For that, usually the salaries will be, say, between 15,000 to 20,000 dirhams per month. Again, you have to go through the eligibility criteria. You have to pass certain exams, which has spoken in before, some videos, and then you can apply for the job positions in a hospital. And then you can work as a registrar here. Secondly is the specialist. Specialist will be usually anywhere between 25,000 to 30,000 dirhams as absolute basic initial salary. But it might differ. It might be more in certain situations. It might be around 25 to 30,000 dirhams. Now, it depends upon what specialty you come to. Like for example, a radiology will usually have higher salaries, whereas somebody in a clinical specialty like surgery will have maybe low salaries to begin with. But then they will have more incentive-based packages based on number of surgeries and the procedures they do. So it is variable based on the salary, based upon the procedures that you are doing. And for radiology, it is usually a lump sum package. So the salaries are usually higher because we don't do any surgeries or procedures unless you are doing interventional radiology. So and as a consultant level, consultants are usually the ones who have got some additional fellowship qualifications or some Western qualifications, or they are Western trained. And in that cases the salaries are much higher. Like maybe even around 70 or 80,000 dirhams per month. And going higher. Now, 3 important points in this to see is whether you have UAE experience. If you have prior UAE experience, then your salaries will be more higher. But somebody who has come to the UAE for the first time, then their salaries will be initially low to begin with, and gradually they can go up based on your experience. And the second most important thing, especially for radiology, I would say, is like which procedures are you doing? Or for a surgeon, what surgeries are you doing? If you are doing complicated surgeries, major supra-major surgeries, then your salary bracket might be on the higher side. You can negotiate for a higher package. Secondly, if you are in radiology, if you are doing say, anomaly scans, if you are doing musculoskeletal ultrasounds, if you are doing CT scans and MRIs, if you are reporting CT and MRI in that if you are doing complicated cases like CT, angiograms, CT coronary angiograms, for the cardiac MRI. So these are all procedures. If you are doing then obviously then you can negotiate for a higher salary. If you are doing all modalities like say CT, MRI, X-ray, ultrasound, and then if you are doing all the procedures in those particular modalities, then obviously you can expect a better salary package. Third thing is, if you are doing any on-call services or emergency services at night, then you will obviously get paid separately for it. That will be considered different. If you are working in a hospital setup, then you will have emergency duties. If you are working in a clinic, then there will not be any emergency duties. So your salary will be whatever they are paying you. Accommodation goes, people ask me, so accommodation IJH, as far as these usually given as a part of the salary package. They will include some amount as accommodation expenses. IJH, some people might give you a place to stay, but then they will deduct that amount from the salary. If you are in a very high position or a consultant level position, then your salaries are also higher than accordingly the perks which come along with that, maybe they might give you accommodation to stay also along with your salary. So that is very, very variable. But by and large I would say for majority of people's salary will be including accommodation also. So you have to find your own accommodation. And accommodation obviously is on the higher side in Dubai, but there are many places where you can get cheap rentals also, so it is a part of the salary package. A working environment. Working environment is very good. Working environment is a work-life balance is very good. You have fixed salary, you have fixed working hours, and then you will have a break. After that you will have a weekly off, and there will be around 10 to 12, sometimes more or sometimes less, annual holidays. So you will get holidays on those days. If you are working on those days, then you will get compensatory offs upon some other days, or it will be added to your annual salary and you will get 30 days of annual leave here. Plus you will get some amount of annual holidays, compensatory offs because of the annual holidays as well. So around 30 to 40 holidays you can expect to get every year. I mentioned quality of life is very good. IJM, the work-life balance is very good. IJH, it's a very high quality of life here. IJM, the other thing is the new thing which has been added is the golden visa for healthcare professionals. Now, this is something which is very interesting and a very good initiative taken by the government of Dubai, where they are giving golden visas for the people who are working in the healthcare facility. And it's a 10-year visa for the people who are working like the doctors and also for their dependents, for their wives and for their children. And it's a very good initiative. It is a nice because they wanted their country to be prepared in cases of a pandemic situation, that the doctors are like an asset to the country and they are working for the patients in this country. So it's a very good initiative. And we have all been beneficiaries for this healthcare. The golden visa, and I myself have been given the golden visa by the government of Dubai. So I'm very thankful to the government as well. And for all people who want to come and work in Dubai, I would say it's a fantastic opportunity. You get excellent work-life balance, you get excellent quality of life. Working patterns are very good. Salaries are paid on time because it is governed by the Ministry of Labour. So there is no worry in that as well. And plus, you have the golden visa, so you can plan your life for the next 10 years. For yourself, your family, your children. The schools and colleges here are real so excellent and world class. So in general, I would say it's a win-win situation. To come and work in IJI. In case you have any questions and if you have any queries, just let me know in the comments and we'll try and address them individually or make a video on that. Thank you so much.